بسم الله الرحمن الرحيم. موعدنا اليوم مع افتتاح الدورة التدريبية لتطعيمات الشتاء، ويسرنا وجود الدكتور محمد السعدان معنا اليوم هيلقي عليكم كلمة الافتتاح. تفضل.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. السادة الحضور الكرام، نفتتح اليوم البرنامج التدريبي للأطباء المشاركين والقائمين في حملة الشتاء، تطعيمات الشتاء لعام 2022-23، ونستهل حملتنا لهذا اليوم بهذا البرنامج والعام السابع على التوالي. وبهذه المناسبة أحب أرحب بالحضور وبكوكبة من الأطباء الذين ساهموا بشكل كبير وفعال وبشكل مشرف في السيطرة على وباء كوفيد 19 على مدار أكثر من عامين متتاليين. فقد ضربتم المثل في المثابرة والجهد والتضحية حتى وصلنا إلى ما نحن عليه الآن. وأصبح لنا أيضا خبرة واسعة في مجال حملات التطعيم والتعامل معها، حيث طعمنا أكثر من 3 مليون شخص بجرعتين على الأقل من تطعيمات كوفيد، وبنسبة أكثر من 85% من الفئة المستهدفة من المجتمع، وفي وقت قياسي، مما وضع الكويت في مقدمة الدول التي واجهت الجائحة بالتطعيم. وفي هذا السياق فإن وزارة الصحة تولي اهتمامها بالتصدي للأمراض المختلفة على الدوام. على الرغم من نجاحنا في التعامل مع مرض كوفيد، إلا أن تصدينا للأمراض المعدية لم ينتهي بعد، خاصة تلك التي تنتشر بين أفراد المجتمع حيثما كانوا، ومن أهمها الأمراض التنفسية المعدية التي يمكن الوقاية منها بالتطعيم، والتي تشمل الإنفلونزا الموسمية والالتهاب الرئوي النيموكوكل. ويتسبب كل من الإنفلونزا والالتهاب الرئوي من المعدلات الكبيرة من المضاعفات والوفيات، حيث يتوفى سنويا على مستوى العالم ما يقارب نصف مليون من الإنفلونزا الموسمية، ويتوفى 1.6 مليون من ميكروب الالتهاب الرئوي النيموكوكل، مما حدا بالدول الاهتمام بوضع السياسات والخطط الوطنية لمكافحة تلك الأمراض. فلماذا يفقد من هم من فئات الاختطار سنوات من حياتهم بسبب هذه الأمراض، بينما تتوفر الطعوم التي تساهم في الوقاية من مضاعفات هذا المرض؟ بتضافر جهود الكثير من الأطباء بوزارة الصحة، منهم من يحضر معنا اليوم. بدأت أول حملة لتطعيمات الشتاء في عام 2016، واستهدفت وقتها ما يقارب 150 ألف، منهم نسبة كبيرة من فئات الاختطار. توالت الحملات بعدها ولم تتوقف في ذروة وباء كوفيد، بل حققنا أعلى معدل تطعيم ضد أمراض الشتاء في العام الماضي وفي ظل جائحة كوفيد، حيث وصل عدد المطعمين إلى حوالي 330 ألف شخص حصل التطعيم. وبإذن الله نخطط هذا العام لتطعيم حوالي 400 ألف شخص، مع التركيز على الفئات الأكثر عرضة لتلك الأمراض. السادة الحضور الكرام، أتقدم في هذه المناسبة بالشكر الجزيل لكل القائمين على حملة تطعيم الشتاء، وكافة العاملين الصحيين من أطباء وممرضين وممرضات وفنيين وإداريين، وكلنا ثقة بأنكم لن تدخروا جهدا في سبيل إنجاح تلك الحملة بإذن الله. وفقكم الله إلى ما فيه خير ولوطننا العزيز، والسلام عليكم ورحمة الله وبركاته. دكتور حمد بسكي، رئيس قسم مكافحة الأمراض المعدية، تفضل.
Assalamu alaikum jami'an. Good morning, everyone. I'm going to give you an overview of the winter vaccination campaign for 2022 and 2023. Just to highlight, I'm going to start off with the background, followed by the importance of vaccination. I'll give an overview on the global burden of influenza, focus then specifically of influenza in Kuwait, discuss the previous vaccination campaigns from the start of the vaccination campaign in 2016, and I'll end with a summary on the winter vaccination campaign strategy for this year. Background on influenza. Influenza is a contagious respiratory illness caused by the influenza virus. Between 250,000 to 650,000 deaths occur annually and are associated with respiratory diseases from seasonal influenza. And there are 4 types of seasonal influenza viruses, A, B, C, and D. And for seasonal epidemics, the main causes of the are the influenza types A and B. And every year, the extent of the outbreak differs. This is because there's the changing nature of the antigenic properties of the virus over time, which can result in altered transmissibility and severity of disease. So minor changes to the envelope of the glycoproteins result in antigenic drift, and they can cause epidemics. And major changes to the envelope of the glycoprotein result in antigenic shift, and that can result in pandemics. The susceptibility of the population is affected by the proportion of individuals that are vaccinated and other community-wide non-pharmaceutical preventive measures, such as what happened during the COVID-19 pandemic. Just as an overview, I'm going to give a few examples of other vaccinations just to highlight the importance of vaccination. So this slide looks at the history of vaccinations. So the smallpox vaccine was first discovered in 1796, and smallpox was eradicated globally in 1978. The polio vaccine was first discovered in 1955, and since then, polio has been eliminated from the majority of countries. There are still a few countries which still have a few cases of polio, but the majority of countries have eliminated it. In Kuwait, the polio vaccine was introduced in 1963, and the last case of polio was detected in 1986. And if we look at the MMR vaccine, the MR vaccine, so at the time there wasn't the MMR, so the MR vaccine was introduced in 1986, and this resulted in a huge reduction in the number of cases, and now there's only sporadic cases detected every year. So just to highlight that in figures, if we look at when the MMR vaccine was introduced, it started off in the range of hundreds of cases per year. With the introduction of 1 dose in 1986, there was a marked reduction in the number of cases. And then if we look at the introduction of the 2nd dose, because it's a 2-dose vaccine, there was a further decrease after its introduction in 1995. If we look at the global burden of flu, approximately 20% to 30% of children and 5 to 10% of adults develop symptomatic influenza. This results in approximately 500 million people per year, so it represents a huge burden. And of those, 2 to 3 million people develop severe disease. And approximately there are 250 to 650,000 annual deaths globally due to influenza. And the burden of disease can vary greatly from year to year and is determined by several factors. These include the characteristics of the circulating viruses, the timing of the season, how well the vaccine works to protect against illness, and how many people get vaccinated. And with us, we have 2 factors we can control out of these. It's how many people get vaccinated. So the aim is to vaccinate as many individuals who are eligible as possible. And another thing we can control is the timing of the vaccination campaign. So the earlier we start the vaccination campaign before the season, the more individuals we can protect. This is just a summary which demonstrates how the burden changes year on year, given the factors I had described previously. So we could see that there are huge variations in the annual burden. So if we look at the US figures, it ranges between 9 million on the lower end to 41 million illnesses per year between 2010 to 2022 in the United States, between 140,000 to 710,000 hospitalizations per year, and between 12,000 to 52,000 deaths annually in the United States during that period. If we look at the global number of influenza cases over time, we could see that it follows a general seasonal pattern year on year, 2018, 2019, 2020. We could see that the cases resulted in almost zero, close to nothing during the 2021. This was because of the strong mitigation measures which were present during the last 2 years. But something else which we could see from this graph is there's a change in the pattern of the flu cases for this year. So usually if we see it occurs during the season, it's seasonal pattern. With 2022, we could see that the cases are distributed over a wider time frame for this period, and it occurred out of season. So this is characteristic following the pandemic, that once you eased restrictive measures, that there is a resurgence in the number of cases of flu. And we'll demonstrate that in the figures from Kuwait as well. So the influenza, just to reiterate, influenza circulation during the COVID-19 pandemic has been generally low, potentially due to increased health-seeking behaviors, application of preventative measures like physical distancing, mask wearing, and personal hygiene, a reduction in global travel, and increased uptake of influenza vaccine. This isn't replicated globally, but it was specific to Kuwait. The Kuwait had an increase in the number of vaccine doses given during this period. And a resurgence of seasonal influenza vaccine is expected, and it is demonstrated over the figures from the last few months, and we will see. And this is due to easing restrictions and increase in global travel. So looking at the figures from Kuwait, just to keep in mind that these figures are obtained from notification and from Sentinel sites. So it does not reflect the total number of flu cases in Kuwait, but it gives a representation of trends over time. We could see that there has been an increase in the number of flu cases detected due to, again, both measures, either a true increase or improvements in notification. But one thing we can see is that there was a huge reduction in the number of cases during 2020 and during 2021. So if we break this down and we look at the months, and we specifically focus over the last 6 months, we could generally see that the cases mainly occur during the winter months from 2018 to 2020, and they decrease towards the summer months. If we specifically look at 2022, we could see that there has been low number of cases, generally, but an increase in out-of-season flu cases. So if we look at May, June, July, there are cases in 2022, whereas previously there was very few cases detected during the same period over the previous years. This also supports the view that there is a resurgence in the cases following easing of restrictive measures, and this highlights the importance of the vaccination campaign for this year. So it highlights the importance of you encouraging everybody who's eligible to receive the vaccine. So next I'll go over the history of the vaccination campaign in Kuwait. It was first launched in 2016, and it has continued annually. The objectives of the campaign are to decrease the incidence of cases and deaths due to influenza, to increase vaccine uptake in high-risk groups, mainly pregnant women, elderly, healthcare workers, children less than 5 years and older than 6 months, and individuals with medical comorbidities. And our aim from the department is to have an increase in coverage by at least 20% compared to the previous year, every year. And the ultimate goal is to decrease hospitalizations and morbidity due to influenza. Additionally, during the period of the pandemic, we had introduced an electronic system to book an appointment to minimize overcrowding and to ensure social distancing. If we look at the number of doses given since 2016, we could see that generally it ranged between 120 to 140,000 doses per year, with a marked increase in 2020, where we had given approximately 300, it's more than doubled to 330,000 doses, and a further increase to 337,000 doses in 2021. And the goal for this year is to increase the number of doses administered even further. And I'll discuss the strategies used this year to hopefully increase the coverage with the support of all the healthcare workers here and listening with us today. This is just a glimpse and overview of the different posters we had, different posters which were since the start of the campaign. And for this year, we plan to launch the campaign at the end of this month, so end of September 2022. And the types of vaccines which will be available will be the seasonal flu vaccine. It's a quadrivalent vaccine which covers 4 serotypes, and the pneumococcal vaccine, the 13-valent pneumococcal vaccine, conjugate vaccine, and the 23-valent polysaccharide vaccine. And Dr. Abdurrahman will discuss further the indications for these vaccines. For the flu vaccine specifically, the eligible population would be all individuals over 6 months of age. And the target population, we will target everybody who is eligible, with a strong emphasis on individuals who are at increased risk of severe disease or transmission of flu. Who are the high-risk groups? I briefly mentioned them earlier, but just to go over them again: individuals aged older than 6 months and less than 5 years, individuals aged more than 50 years, healthcare workers, immunocompromised individuals, pregnant women, individuals in long-term care facilities, and individuals with chronic conditions. So looking at the previous years, we aim to continue everything which was delivered in the previous years, but to add additional venues for vaccination. So looking at the sites from last year, preventative centers and health regions will continue to cover the general public. Preventative centers and hospitals will offer the vaccination to inpatients and to healthcare workers. The COVID-19 vaccination centers, we aim to continue co-administration of the vaccine. So any individual who attends for COVID-19 vaccination should be offered the the influenza vaccine at the same time. The private medical centers have historically offered it, and it will still be available in private. Mobile vaccination units will still continue to offer the flu vaccine for individuals with limited mobility. Other sites which have historically taken part will continue to take part, such as the KOC hospitals, the Ministry of Interior Hospital, the Armed Forces Hospital, and the Central Prison, in addition to the long-term care facilities. For this year specifically, to increase the number of doses, and hopefully this will be built up upon year on year, we plan on including additional vaccination sites. The Kuwait University will take part in this year's campaign, and they will offer the vaccine to eligible students and the faculty. School health vaccination sites will have the option of including this vaccine at the vaccination sites and giving it to high-risk children with a medical file at those schools. Additionally, in the routine immunization rooms, the flu vaccine can be co-administered with routine immunization. So it should be offered at 1 year and at 2 years and at 18 months with other vaccines. So this will greatly increase, and specifically for this group, it will target those who are a high-risk group. They're less than 5 and they're over 6 months. So it's an opportunity for vaccination. Additionally, outpatient clinics were recruited in hospitals and specialized centers. So there will be vaccination offered next to the outpatient clinic to decrease missed opportunities for vaccination and to increase coverage for those who are high risk in diabetes OPDs and next to internal medicine clinics. And a strong emphasis on this goes on the preventive medicine doctors in the hospital. The success of outpatient clinic vaccination delivery relies on the preventive medicine doctors to increase awareness of the doctors within the OPD clinics to refer the patients to the vaccination sites, which has been made accessible next to the OPD clinics. Other strategies to increase uptake this year include improving accessibility. The number of vaccination sites has increased to more than 100 vaccination sites, and the type of vaccination sites have been widened to not only focus on preventative medicine clinics. So there's other sites of vaccination which have been made available. And this is thanks to the introduction of the electronic vaccination system, which allows us to monitor the vaccinations over time. And Dr. Najah will discuss this more in detail. The second strategy is to increase the number of available doses. Last year, we had a challenge where there was the delivery of the vaccination doses occurred at different time frames. And that resulted in us needing to prioritize the vaccination, and individuals who had come early on during the season, a few had to be turned away and rescheduled for a later time frame by focusing on those who are most eligible at the start of the campaign. This resulted in a missed opportunity because individuals who come and are subsequently turned away would not likely come back again, or would be less likely to come back again. So to avoid this, we had a strong emphasis of including receiving all of the doses early in the season to avoid turning anybody away during the vaccination campaign. The third point is to increase awareness for those who are high risk. So with the COVID-19 vaccine registration system, we have a large number of individuals who registered their medical comorbidities, and it would be easy to send SMS messages and highlight the importance of receiving the vaccine to those individuals. And this would be a target and an opportunity to increase coverage in those who are high risk. And the fourth, which is specific for this year and which could be changed in future years, is this year we avoided strategies that were previously used that may be perceived as forceful. So previously, there were vaccinations being offered at malls, at supermarkets. This year, we avoided to not go down that route because this year we sense that there could be vaccination fatigue due to all the vaccinations given during over the last 2 years, and it may be seen as forceful towards the population as individuals to receive the vaccine. So we only made it available at sites which people expect there to be vaccination, and over time we hope to then gradually, with improved public perception, to introduce it back in public spaces. And that's all for now. We'll take questions towards the end of the discussion. So there's 30-minute discussion time. I'll be happy to take any questions you have regarding the vaccination strategy. Dr. Abdulrahman will be next in presenting his aspect of the campaign. Thank you.
بسم الله الرحمن الرحيم. طبعا هنتكلم شوية عن موضوع some techniques and procedures and some points stressing on the co-administration of the vaccine with other vaccines. So we'll give you a small hint about the campaign. As Dr. Hamad told us before the last lecture, the lecture will overview the background and campaign justification, who will be vaccinated and when, the influenza vaccine contraindications, and concurrent administration of influenza vaccine with other vaccines. And lastly, we will stress on the campaign hesitancy and personal experience. This year, the vaccine is quadrivalent vaccine, and it differs from the vaccine of the last year. احنا هنا لو نشوف ال composition of the vaccine components, it is a vaccine tetra. This tetra four strains, 2 strains A and 2B. The difference is one strain, which is H3N2, and the other strain is B. It differs from the last year. So احنا لما بنيجي نتكلم على السترينز برضه في نقطة مهمة هنا، إن في ناس بتسأل ساعات مثلا لو احنا طعمنا الحجاج، فتطعيم الحج كان من حوالي 4 شهور أو 5 شهور، احنا ادينا الكوادريفيلنت بتاع 2021 2022. فاللي بيسأل لو واحد اتطعم في الحج وعاوز يتطعم في الحملة دي، يتطعم طبعا، لأن الاسترين اتغيرت، واحنا هنقدر ندي الاسترين الجديدة طالما يعني مفيش يعني مينيمم انترفال بين الفاكسين والفاكسين، فاحنا نقدر ندي الاسترين الجديدة حتى لو هو خدها في موسم الحج من 4 5 شهور، او حتى لو هو خدها من 6 أو 7 شهور، ممكن نقدر احنا نديله الاسترين الجديدة لأنها مختلفة عن السنة اللي فاتت. طبعا ده احنا الافكتفنس اوف ذا فاكسين، احنا عندنا الفاكسين يعني الافكتفنس ده بيوصل لحوالي 40%. اخر سترين كانت 35%. طبعا السترين زي ما قال الدكتور حمد في 2021 كان من الصعب جدا ان احنا نحدد الافكتفنس عشان موضوع الكوفيد، فما كانش فيه ستاديز اتعملت في الوقت ده. لكن السنه اللي فاتت كان الافكتفنس اوف ذا فاكسين از 35%. طبعا احنا ليه بنطعم الفلو برغم ان الافكتفنس بتاعته بتبقى قليله؟ فاحنا لو شفنا هنا طبعا بالنسبه للفلو ده يعتبر، احنا لو قسمنا الامراض المعديه ل4 اقسام، قسم يبقى هاي انسيدنس هاي مورتاليتي، او لو انسيدنس هاي مورتاليتي، او هاي انسيدنس لو مورتاليتي، او لو انسيدنس لو مورتاليتي. فالانفلونزا وحتى النيموكوكال بيعتبروا من الهاي انسيدنس هاي مورتاليتي، وده السبب ان احنا ستريسنج على الفلو فاكسين والنيموكوكال فاكسين during the campaign due to the high incidence and the high mortality. Regarding the pneumococcal also, we have the global lower respiratory infection، ويعتبر النيموكوكال في الاكستريمز اوف لايف في الاطفال من سنه الى 4 سنين بيبقى الانسيدنس بتاعه عالي جدا، وايضا الانسيدنس بتاعه في الاكستريم ايجز او في الهاي في الاولد ايج بيبقى عالي. فبالتالي احنا لازم نركز على التو جروبس دول في الفاكسينيشن، سواء الاطفال لغايه سن 5 سنين او للادلتس او للاولد ايج فوق ال 60 سنه، ودول بنعتبرهم هاي ريسك حتى للنيموكوكال ديزيز. النيموكوكال ديزيز بيعتبر برضو من الامراض زي ما قلنا هاي مورتاليتي هاي انفكتيفيتي، وعشان كده احنا بالنسبه للنيموكوكال احنا دلوقتي طبعا عندنا النيموكوكال احنا بدانا نطعم من سنه 2006، يعني اللي هم عمرهم فوق ال 16 17 سنه دول المفروض ان هم مطعمين نيموكوكال. فاحنا هنستهدف برضو اللي فوق 18 سنه هنديهم نيموكوكال اذا كانوا هم من الجروبز اوف هاي ريسك، يعني سواء في المدارس او في جامعه الكويت او في الفئات الاخرى اللي فوق 18 سنه eligible to receive the pneumococcal if they are at high risk. طبعا بالنسبه للكامبين who will be vaccinated زي ما قلنا بالنسبه للفلو everyone 6 months and older should get an influenza vaccine every season with rare exception. دي طبعا this is a recommendation of the CDC. And the vaccination to prevent flu and its potentially serious complications is particularly important for people who are at high risk of developing serious flu complications. وطبعا انتم عارفين who are at high risk regarding the influenza. Regarding the pneumococcal, they're eligible for vaccination everyone 2 months and older should get pneumococcal vaccine. And also vaccination is to prevent pneumococcal disease and its potentially serious complications, and is particularly important for people who are at high risk. Regarding the dose of influenza vaccine, we are giving the full dose for everyone starting from 6 months. Before احنا كنا بندي للاطفال لغايه 8 سنين بندي نص الجرعه. دلوقتي طبعا احنا بدانا ندي جرعه كامله، وبين الجرعه والجرعه المفروض 4 ويكس، فبندي جرعتين بالنسبه للاطفال اللي من سن 6 شهور لغايه 8 سنين اللي ما خدوش قبل كده، او اللي ما نعرفش اذا كانوا خدوا ولا لا. يعني احنا لما نيجي نسال ساعات الاب او الام بيقول لك مش فاكر هل هو خد الانفلونزا فاكسين ولا لا. في الحاله دي بنعتبر ان هو ما يعرفش، فنديله جرعتين. هياخد جرعتين بينهم وبين بعض 4 أسابيع. طبعا احنا لازم المفروض ان احنا نبدا بالاطفال، لان احنا هندي جرعتين، غالبا هندي جرعتين، فالمفروض ان احنا نبدا as early as possible بالنسبه للاطفال، نديهم في بدايه الحمله. فعشان كده بالنسبه للاطفال لغايه سن 8 سنين المفروض ان احنا you have to ask the parents about the past history of vaccination. If he has a confirmation that he had received the vaccine before, you can give only 1 dose. If you have no confirmation, or if he is sure that he is not receiving the vaccine before, you can give him 2 doses. Other than this, after 5 years, you can give only 1 dose of the vaccine, and this dose of the vaccine should be given, as you know, intramuscular. Regarding the timing of the vaccination, it is better to give the vaccine as early as September, October. إن شاء الله طبعا هيكون available قبل أكتوبر، وهنديه as early as possible. وطبعا في بعض الستاديز اتعملت، وكان الأول برضه في الحملات السابقة زمان كنا بنقول بعد أكتوبر أو بعد نوفمبر ما بقاش التطعيم ليه لازمة. لا، الكلام ده غير صحيح. احنا دلوقتي لما نشوف الستاديز اللي اتعملت دي فيها الفلو اكتيفيتي باي مانث، دي اتعملت في US من سنة 82 لغاية سنة 2020. الاستادي دي بتبين الفوكس اوف او المانث اللي بيبقى اكتر فيه الحالات الفلو، فلقوا ان اكتر مانث في حالات فلو هو فبراير، يليه ديسمبر، يناير ومارس. فاذا احنا لما ندي الفاكسين حتى ليت، يعني في ديسمبر او في يناير، هو هيبقى to be effective because most of the cases occurring in December, January, February and March. So طبعا as early as possible ده مفضل، ولكن لو احنا اديناه في ديسمبر، في يناير، فبراير، ما فيش مشكله، هيبقى still effective. Regarding the influenza vaccine contraindications, طبعا الانفلونزا vaccine cannot be given below 6 months of age. فإذا جالك طفل مثلا عمره 4 شهور وجاي يطعم الجرعة، أو عمره 6 شهور وجاي يطعم جرعة النيموكوكال والبنتا فاكسين، جرعات الأطفال ريكومندد. يعني احنا ممكن نديله موعد، يعني ممكن انت تقولي للطفل او تبلغي السيستر انها ممكن تقول للام ممكن تجيب الطفل الشهر الجاي، طبعا هيكون تم 6 شهور يطعم. ف this is up to you. فانت بلغي الام او بلغي النيرس لما تيجي تطعم الجرعه 6 شهور ان انت ممكن تقولي لها تيجي بعد شهر تاخد تطعيم الانفلونزا. طبعا احنا هنتكلم على الفاكسين كو ادمنستريشن بالتفصيل، وهنقول يعني ايه هي الرولز بتاعت الفاكسين كوردينيشن كو ادمنستريشن في السلايدز الجايه. فطبعا لا، حتى لو طفل عمره 4 شهور وجه ياخد جرعه ال4 شهور، ممكن تديله موعد بعد 3 شهور او 4 شهور، هيكون مثلا في ديسمبر او في يناير يجي ياخد تطعيم الانفلونزا، وده برضه ريكومندد، والسي دي سي ريكومندد ان احنا ندي الاطفال، ومركزين جدا السنه دي على موضوع تطعيم الاطفال، لان زي ما شفنا طبعا ان الاطفال ات هاي ريسك زي الكبار، وطبعا الكومبليكيشنز اوف فلو بتكون اكتر في الاكستريمز اوف ايج، سواء في اللو ايج او في الاولدر ايج. طبعا people second contraindication is people with severe life-threatening allergy to any ingredient of the flu vaccine. لو هو ثبت ان هو to any ingredient of flu vaccine he had allergy before, this is one of the contraindications. Regarding the people who have a severe allergic reaction to a dose of influenza vaccine, this is also contraindicated. Regarding the allergy to eggs, it needs consultation, and I will give you another slide about egg allergy. And if you have a past history of Guillain-Barré confirmed, he should not get flu vaccine. In case of severe allergic reaction to a previous dose of any other flu vaccine, it needs consultation. Any other flu vaccine rather than the quadrivalent vaccine. And persons who have moderate to severe illness, you have to postpone. لو جالك شخص عنده واخد موعد وجاي عشان يطعم وعنده حرارته عاليه، احنا نأجل. فاحنا قلنا حتى المودريت والسيفير it should be postponed، لان طبعا it is not absolute contraindication but it is a relative contraindication. Regarding the egg allergy، دي النقطه اللي هي بتخوف دايما الدكاتره، وخصوصا دكاتره الرعايه الصحيه، اول ما بيعرفوا ان في واحد عنده egg allergy بيقولوا لا خلاص روح ما تطعمش. Regarding the egg allergy، طبعا this is a recommendation of CDC. People with egg allergy no longer need to be observed. كان الاول احنا بنقول لازم ان احنا نلاحظه لمده اي واحد عنده egg allergy حتى لو بسيطه نلاحظه بعد التطعيم لمده 30 minutes، نص ساعه. دلوقتي السي دي سي بتقول لك no longer need to be observed for allergic reaction for 30 minutes. People with a history of egg allergy of any severity should receive any licensed, recommended and age-appropriate influenza vaccine. مفيش مشكلة لو هو عنده egg allergy حتى it is recommended to receive the vaccine. Those who have a history of severe allergic reaction to egg, any symptom غير الهايبس. الهايبس طبعا هي ساعات بتبقى severe، واحد بيعطس جامد او عنده hay fever بعد الايج، بعد eating egg، ده ممكن برضه حتى اللي عنده الهايبس he can receive the vaccine. But anyone who have a severe allergic reaction should be vaccinated in an inpatient or outpatient medical setting. طبعا احنا بنقول بالنسبه للناس اللي بيطعموا خارج الميديكال سيتنج، يعني زي ما احنا بنقول مثلا في الجامعه او في الاماكن اللي هي not a medical settings، you have to avoid giving the vaccine to the person who have a severe egg allergy. But in the inpatient and the outpatient medical setting, you can give. And as you know, we have a manual regarding the allergy after vaccination, and I think it is distributed to all. This is a manual to the people who are vaccinating at home, and people who are suspected to be an allergic, for example, to egg. You have to keep, for example, the EpiPen in the polyclinic, and you have to give the vaccine even if you have a severe allergy to egg, but it should be in the outpatient, in the inpatient or outpatient medical setting. regarding the concurrent administration of influenza vaccine with the other vaccines. Influenza vaccine can be given either concurrently or sequentially. يعني احنا ممكن نديه في نفس الوقت او حتى بعد يوم او يومين او 3 من اي فاكسين، سواء كان live attenuated vaccine or inactivated vaccine. It can be given concurrently or sequentially. يعني ما فيش حتى فرق. يعني احنا مش لازم مثلا لو واحد جه يطعم هيباتيتس فور اكزامبل، ممكن تديله الانفلونزا at the same time. ممكن تديها له هو عنده موعد بعد يومين وجه سألك اخد الفاكسين بعد يومين، قول له عادي مفيش مشكله. يعني مفيش سبيسنج بين الانفلونزا فاكسين و any other vaccine either inactivated or live attenuated. But you have to give, if you are giving the vaccine concurrently, influenza with any other vaccine, you have to give in a separate anatomical sites. احنا بنعتبر الدلتويد ماسل دي تعتبر one anatomical site او multi anatomical site لانها ماسل كبيره. ففي الحاله دي you can give the influenza vaccine with any other vaccine in the deltoid, but you have to keep spacing between the two injections. ولكن بالنسبه للاطفال اللي هم من 6 شهور الى 5 سنين يفضل ان احنا ندي in 2 anatomical sites، او if there is more than 2 vaccines. يعني for example لو احنا زي ما الدكتور حمد بيقول ان احنا ممكن ندي الطفل، او لو جالك طفل عنده 18 شهر وعاوزه تديله الانفلونزا اديله عادي. طب 18 شهر هياخد البنتا وهياخد النيموكوكال، فاحنا ممكن نديله الانفلونزا فاكسين at the same time but another anatomical site. يعني احنا يفضل كمان بالنسبه للطفل المسل اللي هي الفاستس لاتراليس بتبقى في الانتيرولاترال سايت اوف ذا ثاي. حتى الطفل لغايه سن 5 سنين ممكن نديها في الانتيرولاترال سايت اوف ذا ثاي لانها يعني العضله كبيره ونقدر ندي فيها more than vaccine. فالفلو vaccine can be given even with 2 or 3 injections, but it is better to be in a different anatomical site. طيب can we give flu vaccine with COVID vaccines؟ طبعا الموضوع ده احنا تطرقنا ليه السنه اللي فاتت واتكلمنا فيه كتير، وموضوع الكو ادمنستريشن اتعملت عليه ستاديز كتير بين الكوفيد فاكسين والفلو فاكسين. طبعا احنا السنه دي هندي تطعيم الانفلونزا في الكوفيد سنترز. يعني اذا لو في اي حد هنا بيشتغل في الكوفيد سنتر you have to recommend giving the COVID vaccine with influenza vaccine without any harm regarding both safety and reactogenicity. يعني هو الفاكسين ولا بيأثر في السيفتي لو اديناهم مع بعض ولا بيأثر في الرياكتوجينيستي. They are safe to give both vaccines. قبل كده السنه اللي فاتت كنا بنقول لازم 14 يوم بين الكوفيد وبين الانفلونزا، لان احنا لسه ما كناش نعرف يعني ايه هو الفيت اوف ذا فاكسين، وكنا خايفين برضه من موضوع السايد افكتس. كنا عايزين نطمن ان الكوفيد سايد افكتس مع الانفلونزا سايد افكتس ما يبقوش مع بعض يعملوا مشاكل. وزائد ان احنا كنا عاوزين نرصد السايد افكتس او الادفيرس ايفنتس بتاع الكوفيد فاكسين، فاحنا مش عاوزين ندخل حاجه ثانيه لغايه ما نعرف الكوفيد فاكسين وات ار ذا ادفيرس ايفنت. ناو احنا وعرفنا البرسنتج وعرفنا what are the adverse events of COVID vaccine. We can give both at the same time without and concurrently or sequentially. We can give COVID vaccine with influenza vaccine either concurrently or sequentially. This is the recommendation of CDC regarding this is the last recommendation regarding the co-administration. COVID-19 vaccines were previously recommended to be administered alone with a minimum interval of 14 days before or after administration of any other vaccines. This was out of an abundance of caution and not due to any known safety and immunogenicity concern. However, substantial data have now been collected regarding the safety of COVID-19 vaccine currently authorized by FDA. طبعا اللي احنا بنديهم حاليا mRNA vaccines for use under EUA. COVID-19 vaccines and other vaccines may now be administered without regard to timing. يعني نديهم مع بعض او بينهم بعض يوم 2 مفيش مشكله. هنا دي ستاديز اتعملت على الكو ادمنستريشن اوف انفلونزا مع الكوفاكس نوفافاكس فاكسين. وزي ما انتم شايفين هنا بالنسبه حتى لو شفنا الفاكسين الكو ادمنستريشن will not increase the local manifestations or local adverse event, and also it cannot affect the systemic adverse event. And if you can see here down, the placebo, even in the placebo, we have a local adverse event, like pain, tenderness at the site of injection. And if we are giving the influenza vaccine plus COVID vaccine, the adverse events are not increasing significantly. This is some suggestions for concomitant administration. We can give the flu vaccine with COVID vaccine in COVID vaccination centers. We can give the flu vaccine in the antenatal care clinics to pregnant women who are coming to receive, for example, the tetanus toxoid or DT in the clinic, concomitantly with the flu vaccine. Also, we can give the flu vaccine with the children who are coming to receive the MMR at the age of 1 year and 2 years, concomitantly without any harm. Also, we can give the Benta vaccine and pneumococcal vaccine. We can give the flu vaccine with both Benta vaccine and pneumococcal vaccine for children 18 months of age in the child vaccination centers. Also, we can give the flu vaccine with DBT for children with 3.5 years in the child vaccination centers. And we can give the the flu vaccine with DT and MMR in school health for the schools concomitantly without any harm. So these are suggestions to give a concomitant influenza vaccine with the other routine vaccination. Regarding the hesitancy and personal experience, here are some problems regarding the hesitancy I will stress on. حقيقة يعني دي احنا في هنا عندنا some problems regarding the beliefs. في ناس تيجي تقول لك انا مش مقتنع ان التطعيم ده مهم، وانا الحمد لله صحتي كويسه ما عنديش اي مشاكل. لا ابني لا هديله تطعيمين مع بعض او 3 مع بعض، لا انا مش عاوز ادي الانفلونزا. هنا ده دور بقى الطبيب الوقائي ودور طبيب الرعايه ان احنا to overcome the problem of hesitancy. البليف دي one problem. The second problem is the safety and effectiveness. في بعض الناس بتقول لك انا حاسس ان هو يعني في مشكله في الفاكسين، فانا مش عاوز ادخل نفسي في مشاكل. وانا في واحد قريبي خد التطعيم وجاله شلل، وواحد قريبي خده كل دي احنا بنواجهها واحنا لازم نعرف ازاي نتعامل مع هذه النوعيه وازاي نقدر نقنع، دي وظيفتنا. احنا اهم شيء حتى في عملنا الوقائي ان احنا وظيفتنا how to convince و how to overcome the problem of hesitancy. The problem of refusal ده اللي رافض تماما غير الهيزيتنت. طبعا انتوا عارفين الفرق بين الهيزيتنت والريفيوزل. الهيزيتنت بيبقى عنده بس محتاج زي ما بنقول زقه علشان يطعم، عاوزين بس زقه صغيره، فالزقه دي هتيجي من عندك. لكن اللي هو جاي ده غير مقتنع تماما ريفيوز، ده مش هنقدر نعمل له حاجه. يعني انتوا شوفوا احنا الجهود اللي عملتها وزارة الصحة في حملة كوفيد، والاماكن والتسهيلات والفاسيلتيز، ومع ذلك في 15% ما طعموش. هم دول اللي احنا تقريبا بنعتبرهم دول ريفيوز، مش الهيزيتنت. الهيزيتنت الطعاموا الحمد لله، يعني اعتقد الهيزيتنت اعتقد الطعاموا، لكن الريفيوز دول ما تقدرش توصل لهم. بس احنا دورنا ان احنا اوفركم الهيزيتنت. طبعا معلش انا بكلمكم، انا يعني بالنسبه لي انا خبرتي في مجال الفاكسينيشنز والكوميونيكابل ديزيز كنترول اند بريفنشن 35 سنه في الكويت، وياما قابلنا مشاكل كثيره جدا ولغايه دلوقتي بنقابل مشاكل. لكن احنا عاوز اقول لكم من 35 سنه كانت المشكله اكبر من كده بكتير. يعني كان الريفيوزل ده رهيب والناس ما كانتش مقتنعه. دلوقتي بدات الناس تقتنع بالتطعيم وباهميته. وجت مشكله صغيره كده في 95 96 انتوا عارفينها كلكم، اللي هي بتاعه الMMR والاوتيزم، وبدات الناس تقلق تاني من موضوع الفاكسينيشن. ولكن الحمد لله يعني بعد موضوع الكوفيد والناس اطمنت، الكوفيد فاكسين سيف والعالم كله اطمن، فاحنا بنتوقع ان الكفرج والهيزيتنسي هتقل في الفتره اللي جايه. فاحنا من خبرتنا بقول لكم حاجه مهمه جدا. انت كطبيب وقائي او طبيب في الرعايه الاوليه لازم تبقى دايركت، لازم تبقى اونست اند كونفيدنت. لما تيجي تتكلم مع المراجع تتكلم معاه بثقه وتبقى، يعني انا بشوف دكاتره كتير، كنا بنشوف دكاتره يقول له انا مش عاوز اطعم ابني، يقول له خلاص انت حر ده يعني. طب التطعيم ده والله يعني دي حاجه ترجع لك. غلط. You have to be honest and you have to be confident. يعني لازم تبقى واثق عشان توصل المعلومه للمراجع ان الفاكسين ده مفيش منه مشكله. You are the doctor and you have to be the leader and don't be indecisive. ما تحاولش تكون متردد مع المراجع، لازم تبقى قوي ولازم تبقى صاحب قرار. Take every opportunity to advise في اي مكان وفي اي وقت. يعني احنا دايما كنا بنكلم دكاتره الديابيتولوجي نقول له لازم في موسم الشتاء في الوينتر فاكسينيشن لازم كل مراجع لما يدخل لك to have this opportunity to advise. دي فرصه ان انت تنصحه ان هو يطعم. مراجعين السكري في الكويت لا يقل عن 500,000. فالنص مليون ده لو كل دكتور ديابيتولوجي خد من وقته دقيقة واحدة عشان يقنع المراجع إن هو ياخد الفلو فاكسين وينتهز الفرصة دي طبعا هيبقى لها امباكت عالي جدا. وخاصة انتوا عارفين طبعا مريض الديابيتس ده هم يعتبر من الهاي ريسك جروبس due to the problem of immunity. and don't just check the box. يعني مجرد يجي لك عاوز تطعم، لا طب خلاص مع السلامه، لا ما ينفعش. take the time to find out what the hesitancy is, and if the patient agrees to get vaccinated on different date make sure it is scheduled before they leave. لو جالك مثلا مراجع في عياده السكري او زي ما قلت لكم طفل عمره 6 شهور، دي فرصه ان انت تقولي لها تعالي بعد شهر، تديها موعد وتقولي لها تعالي بعد شهر طعامي انفلونزا. and you have also to know the guidelines. طبعا الجايد لاينز احنا وزعناها عليكم وكلكم قاريينها وعارفين ايه اللي موجود فيها. دي بعض الاسئله اللي كانت بتسالنا. I don't want to get sick. انت دورك تقولي له ايه؟ هو جاي بيقول لك انا مش عاوز اعيا، انا باخد الفاكسين وبعيا. You wouldn't get sick, but you could have a common reaction that can be treated with over-the-counter analgesics. مجرد حبايه بنادول وخلاص الموضوع بينتهي، مفيش مشكله. لو ورمت ولا سخونيه بسيطه حبايه بنادول بتضيع دي الاجابه. I'm waiting for more studies to be done. طبعا احنا لازم نقول مش more studies، احنا ادينا ملايين الجرعات من الانفلونزا وملايين الجرعات من النيموكوكال ومفيش اي مشاكل، وان السي دي سي has one of the most robust and effective safety monitoring system. السي دي سي دي اعلى monitoring system للفاكسينيشن في العالم، ومع ذلك هي they have to monitor every year the what's called VAERS اللي هو vaccine adverse event system. Some vaccines have extremely rare issues. The benefits of the vaccine far outweigh the risk. دي دايما احنا لازم نقولها، ان انت الفاكسين فوائده اكتر كتير من المشاكل اللي ممكن تعرض لها بسبب المرض. في بعض الناس يقول لك طب ما هو الفيروس دي اللي هي موجوده في ناس بتطلع بقى وتقرا الفيروس ده اللي في السي دي سي في الاف حالات الوفيات مسجله. طبعا الفيروس ده او اني ادفيرس ايفنت سيستم هو بياخد بس الادفيرس ايفنت، لكن الكوريليشن بين الادفيرس ايفنت وبين الفاكسين يعني نوت بروفد في حالات كتير جدا. يعني على سبيل المثال واحد تطعيم انفلونزا وبعد اسبوع مات، هل ده هيكون من الانفلونزا؟ طبعا دي كلها حاجات يعني not proved و it is very difficult to prove all the vaccine adverse events. وزي ما وريتكم في السلايد اللي كان فيها البلاسيبو، حتى البلاسيبو بيعمل adverse event. فدي برضه نقطة لازم احنا نفهمها. I don't want to be microchipped. في بعض الناس تقول لك اصل الفاكسين ده فيه مايكروشيب وده احنا كل معلوماتنا هتروح، فده مايكروشيب wouldn't fit in the needle. مش ممكن المايكروشيب دي تبقى موجودة في النيدل يعني. في ناس بقى تقول لك I don't want anyone to track me. برضه في ناس مقتنعه ان التطعيم ده وخصوصا في دول زي الباكستان والدول دي بيبقوا فاكرين ان في تراكنج، وطبعا دي نظريه المؤامره موجوده يعني. فهنقول لهم they already do. It's called your cell phone. يعني الموبايل نفسه ده تراكنج. ف يعني ده اقوى 100 مره لو كان في تراكنج في الفاكسينيشن. فالسيل فون الموبايل بتاعك انتم متراقبينه وكل الناس عارفه، العالم كله عارف عنكم كل حاجه. فدي ما فيها. اخر حاجه بقى والاهم دي اللي هي I don't need to be vaccinated because I'm healthy. ناس كتير جدا انا ولا بيجي لي العيا ولا بعيا والحمد لله انا صحتي كويسه وما فيش داعي ان انا اتطعم. احنا نديله المثل البسيط ده اللي هو السيت بيلت، حزام الامان. انت هتقول له انت بتسوق كويس، بتعرف تسوق؟ يقول لك اه انا بعرف اسوق كويس جدا. امال بتحط حزام الامان ليه؟ عشان ما تاخدش مخالفه ولا عشان خايف ان انت تموت؟ فهي دي الفكره، مهما كان الواحد بيعرف يسوق لكن لازم يحط حزام الامان. نفس الفكره في التطعيم، مهما كان الواحد صحته كويسه، مهما كان الواحد الحمد لله ما عندوش اي حاجه ولا عندي امراض ولا عندي اي كومبليكيشن، ومع ذلك عشان كده مش عايز الطعم. الصحه والمرض دي حاجه من عند ربنا، احنا ما نقدرش نتدخل فيها، ولكن you have to be prevented. You have to take the vaccine، لان حتى الفلو كومبليكيشنز ممكن تيجي للهيلثي بيرسون، ممكن تيجي لاي واحد حتى لو هو مش في الهاي ريسك جروبس. فعشان كده احنا دايما لما نحب نتكلم، لو واحد قال لك انا صحتي كويسه ومش محتاج، نديله المثال بتاع حزام الامان يمكن يقتنع، فربنا يسهل. عموما احنا متشكرين جدا لحضوركم، ونترك بقى الميكروفون للدكتور ناجح للمحاضره الجايه ان شاء الله. شكرا جدا.
Assalamu alaikum. I will talk today about the electronic immunization system, and I will give an overview about the system, and I will talk specifically about how we register the winter vaccination. Of course, now in all health center, we are still using the manual registration, but at the same time, we're using the electronic system. So we'll continue using the manual and the electronic until we get to some point that we'll stop the manual and we will be only on the electronic. So I will give some overview. Okay. I'll talk about the disadvantages of the manual immunization registry, and then I will talk about the advantages, and we will talk about the users and their privileges. So all of us know that the manual registration, it has inability to provide timely access to information. Now, if I need any vaccination history, and if I will get it from the manual, definitely this will take time. So I will not be able to have it on a timely manner. You will not be able to perform timely vaccination monitoring. It needs time and efforts. Of course, everybody knows that the manual also needs time from our staff to get any vaccination history. It needs skilled medical staff. All nurses now, they need to know the schedule of the routine immunization at end of second month, into 4 months, etc. So they need to know the contraindications. They need to know everything about vaccination. But you will see in the system that everything is there. So even the nurse, if she forgot, any schedule, she will find everything in the system, and she can go ahead with that. Difficult to access immunization history, as I mentioned, and difficult to obtain defaulters list. Now also you will see in the system that everybody will be able to see the defaulters and the list of the defaulters. Advantages of the system: it's electronic form, of course, less paperwork, save time and efforts. It's cost effective, it's in-house. It has been developed by the IT department in cooperation with the communicable disease division at the public health department. It provides timely access to information. Of course, accurate and complete data in one system. You will not go like in the manual to many boxes to get the immunization history. It's adaptable and allowing for new updates. Whatever updates we need, we can just contact the IT department and we can change, we can update, we can fix anything. It's monitor individual vaccination status in a timely manner, as I mentioned, automated generation of the reports, and we will show you now also how the system will generate the reports. We have many reports that will be produced by the health centers manually. Now the system will be able to generate these reports, and we started with some main reports, and later on, inshallah, in the future, we'll continue to have more reports to be generated from the system. And of course, last thing, the data privacy and confidentiality. It is very important that the system keep. Now, the users and their privileges. We have nurses, we have health inspectors, we have doctors, we have head of public health department. So as you can see that, we give the user privileges according to their positions. Head of Communicable Disease Control Division and doctors working in the department, full access to the system, while the health inspectors and the department, they have only access to the report section of the system. I will show you now, after I finish this presentation, how we log into the system and the two sections of the system, the vaccine registration and the reports sections. So head of public health division and doctor working in the health region, they will have full access to the system for the health region in which they are working. Health inspectors, they will have access to the report section of the system. And recently we have received some requests that, we need the health inspectors also to have access to the immunization part, So they have been given access to the missed and previous vaccination part of the immunization section in order to assist the nurses in administering any missed or previous vaccination. And last thing is the nurse who are working in the health center, they will have access only to the immunization section. That's been for vaccine registration. Now, this is how the system looks like. Everybody will have a username and password. You will be able to log in to the system. Of course, you will see now that we will have 2 pages for the system. One is the immunization login, and the other one you will see is the immunization dashboard. So once you log in, you will have this menu in which you will be able to change your password. The first thing that you can do is you can change your password. So simply you will put your old password and you put your new one, and then you can change it. Then you will find here that you can select a civil ID or you can select manual. That's mean you can do a registration either by a civil ID or by manual. What we mean by manual, for example, newborn, they don't have civil ID. So you will use a temporary ID in order to register, for example, the hepatitis B 0 dose or first dose. And we advise that for the manual for the newborn that you use the رقم القيد اللي موجود in the birth certificate. I'll tell you why later on. You can use any temporary other ID, like for example the civil ID of the mother, but then you have to specify after that. You have to write baby 1 or baby 2 if there is twins, or baby 3. So it's better to use the رقم القيد اللي موجود في شهادة الميلاد. Okay, once, for example, you put a civil ID, then, okay, here also there is something in the menu called shift temporary ID to civil ID. Once the newborn will have a civil ID, then very simply you can put the temporary ID and put the new civil ID, and then you can shift all the vaccine that have been given to that temporary ID to the new civil ID. Okay, there's an option here called select clinic. So once you log into the system, you will have the clinics available in your region. You will not have access to any clinics outside of your region. For example, I'm in the communicable disease department. So once I log in, it will give me the capital health region, and I will be able to access the communicable disease control division or any other places. Why we did this? Because we know that nurses, health inspectors, doctors can go and work from different clinic in the region. So this is very important to select the health centers in which you are providing the vaccine. Okay, once you log in with a civil ID, automatically all the information will come from the vaccine. So you don't need to enter any information. Automatically it will come. As you can see, the civil ID, gender, region, all this information, and the page will continue, to the vaccine details. And here you have to put the passport number and the mobile number and the next appointment. We make the system in a way that you will not be able to save the information or the vaccine if you didn't complete all the information or all the fields. So if you didn't complete any field, it will come back to you saying, that you have to put this. You have to be careful for the next appointment date. Next appointment date is very important for the defaulters list, because the system will give you a defaulter list if 2 weeks pass after the next appointment. So if you put, for example, the next appointment the next day or after, you will find that after 2 weeks from that day, there's a person in the defaulter list, and you'll be surprised, why he's in the defaulter list while his next vaccination is not due. So this is very important. If you have any vaccination that has no next appointment, you can put not applicable. Okay, then you will have the schedule group. Here, of course, you can notice that there is a lot of schedule. Schedule 1, 2, missed and previous vaccination, adult vaccination. So you can select the winter vaccination specifically for this campaign. But in general, if you want to give a routine immunization, there is a schedule 3, current one. If you want to give an adult vaccination, you can select the adult vaccination. And the system has the ability to save any previous vaccinations. So if someone came with you with his vaccination cards 10 years ago, he took some vaccine, you will be able to save this vaccine with an older dates. So coming back to the winter vaccination, once you select the winter vaccination, then you will have the vaccination group, winter vaccination, you will select that also. And once you select that, will come to you a pop-up message. This pop-up message is very important. It will show the contraindications of the vaccine. And this is where I said that, it doesn't need any skilled medical workers because everything is there. So for example, if you open the routine immunization, you'll find all the contraindications of the IPV, of the Rota, of the Penta is there. But there are two important screening questions here. They should be answered. If not answered, the system will not be able to save for you any vaccine. So the first question is, your child is sick today? And the second screening question is about the allergies to any vaccine component. So if the answer is no, you have to click no for both, and then you can make okay and continue. If the answer is yes, there will be a red sentence that tell you, please refer to the preventive doctor. So if there is any yes here, the nurse will refer the case to the preventive doctor, and the preventive doctor will advise her or him, to go ahead with the vaccines or not. So once we answer these two screening questions, then the vaccination type will appear here. Influenza, pneumococcal 13, pneumococcal 23, and specifically here under winter vaccination, you have to select the risk groups if there is a risk factors. So if, for example, we will give the influenza vaccine and the pneumococcal 23, we check the boxes. And for example, he's a healthcare workers, I check also the box, obese. If there is other, then you have the ability to write, what other. For example, I write here thalassemia, let's say. Okay. Once everything is done, you make sure that all the fields are completed. You register the vaccine, and you will find the vaccine in the vaccine history. Okay, so you'll find all the information. Even this is a continuation, even you'll find the risk factors, vaccination by. Of course, the vaccination by, the name will not appear of the person. It will, what appears is the file number of the person. So again, all this vaccine history will appear here. There is only one person in each region who has the ability to delete any vaccine that has been given by mistake. And they have this privilege to delete, so you can refer to them. And by the way, if there is any access problem you are facing for the system, please refer to the IT department, Engineer Haifa. She will assist you in getting access to the system. Okay, this is how the defaulters list also, as I mentioned, for each clinic. Any defaulter, anyone who didn't come within 2 weeks after the next appointment date, he or she will appear in the defaulter list. Once the vaccine is given, the name will disappear from the defaulter list. Now, this is the other page of the system, the immunization dashboard. And until now, the influenza vaccine and the winter vaccination report, or specifically the influenza vaccine report, is still under development. So the IT department are working to develop the vaccine. It will be similar to the Excel sheet. You are filling manually, which include risk factors, which include the number of those who are getting the influenza vaccine. But just I'll give you an overview for the reports in general. So once you log in with the same username and with the same password, you will log into this page. And this page, we call it the search options. Okay. So here you can select any variables and you receive a report either by PDF or by Excel. For example, let's say we will select the region, Hawali region. Then you can go to the district. You select the district, and what will appear for you under hospital name is the name of the health centers. You can select the health center, and then you can get for the date from or date to. For example, you need to see the reports for May 2022. So you select 1st of May until 31st of May, and you will press show report PDF. You can get it either by PDF or either by Excel. So once you press the PDF, the report will appear in this way. This is one of the reports that we are generating manually. We are using, So now it's generated through the system. If you want to be generated by Excel, it will be like this. So this is about the system. Let me try to go practical to show you practical system. Okay, so this is the user. Okay. Hello. Okay, so I now log in to the system. As I mentioned here, you can change the password if you want. You can select clinics, what clinic you want. And here, as I mentioned, there is civil ID and the manual registration. So I'll go with the civil ID. Put my civil ID, I will go in. So as you can see, it's very fast. I will okay, I will go directly here, to select the winter vaccination. Winter vaccination here, I will say no, for example, if the answer for the screening question is no. Here immediately I will select influenza, and if there is any risk, healthcare workers. And when I select register, see, it tells me that you cannot register because I didn't select the next appointment. So I will write not applicable or whatever next appointment, and then I can register and I can see the vaccine history is there. So it will not take that much time, even if you lose the manual and the electronic system, as you can see, within 1 minute, maximum 2 minutes, you will be able to register any vaccine. So this is for the vaccine registration. Let me go to the report one, the dashboard. So this is another page, as I mentioned, with the same username. So now if you need to look for any reports, you can use this dashboard. Takes sometimes a little slower than the vaccine registration page. So this is the search options, as I mentioned. I can select the region. Then I can select the district. Then I can select the clinic name. I then go and select the date. Let's say May 1st until May. And then I press show report PDF and the reports will come immediately. As I mentioned again, the influenza vaccination report is under development, and once it's available, we'll let you know. But let's see, whatever a duration of date you make, it will take more time for the system to be generated. Okay, thank you very much.
Thank you very much, Dr. Najah. There are a few questions online, which they have sent on the system, and I'll just go over them one by one, and then I'll open up for the people in the audience. So the first question is from Dr. Sousan. Influenza vaccine is a vaccine preventable disease, and oseltamivir has a very good effect in treating early cases, and also if used as chemoprophylaxis for contacts, but we still can see a lot of severe cases and death. Is it due to lacking of vaccine awareness and shortage in vaccine supplies? I think there's two parts she's referring to. Oseltamivir, which is Tamiflu. This is generally used for treatment and in Kuwait, but it can be given, as mentioned by Dr. Sousan, for those who have been exposed and contacts of flu cases. It's mainly given to those who are at high risk of developing severe disease, and you should also categorize it by risk of exposure. So those at highest risk of exposure and those at highest risk of severe disease can receive oseltamivir, and it's usually given through preventive medicine clinics. The second part of the question is, will the influenza vaccine be available for everyone? And specifically, it's mentioned to the expatriate without age restrictions. It will be available for everyone, and everyone should register online to receive the vaccine. And once the vaccine campaign is launched, there will be appointments sent for everyone to receive it. There is Dr. Ahmed had mentioned, what is the percentage of healthcare workers that got flu vaccine last year? This is a difficult question to answer because it varies by type, specialty of healthcare workers, and also by region. So I think the message from us would be to encourage all healthcare workers to vaccinate. And ultimately what we have seen is the head of the department or the head nurse in each ward, if they champion flu vaccinations, that there is increased coverage for those areas. So if you can convey that message to members of your team to encourage healthcare workers to vaccinate, you'll end up protecting yourselves and the patients that you serve. So the next questions, I think this is more of a complaint than a question, but we can see, can you tell us how many flu cases were diagnosed in the last 6 months and how many of them were severe and were admitted to ICU? An outcome, what is the percentage of vaccinated patients? How many cases were diagnosed in the last 6 months? It is unacceptable that in 2022, we don't have studies in Kuwait, and we always say a study in USA showed so-and-so. So with regards to this question, in Kuwait, we have sentinel surveillance. So we don't capture all flu cases. Our main objective within the department is to look at trends over time. So we look at the cases of flu within specific regions to inform policy. Obviously, we always encourage increased studies to be done and to have local available local data generated in local evidence. So having increasing evidence from Kuwait would be good. Currently, we have surveillance data and it's from sentinel surveillance sites. So there's another question. Do we have registry of vaccine adverse events? We have started, unfortunately, this should have been started a long time ago, but since the start of the pandemic, there is an electronic registry for vaccine adverse events for COVID vaccine specifically. This is being expanded to include all vaccinations and will be implemented very soon. But the success of the COVID vaccine adverse event reporting pathway has enabled us to leverage that for other vaccinations. Is there any other question? There is one question, I don't think it's related to flu, but we'll answer it anyway. Do we really need to give hepatitis B vaccination in first day of delivery? Many countries postpone it till age 1 year, but not in Kuwait. The main reason for the hepatitis B vaccine dose at birth is to prevent mother-to-child transmission for those who are unaware, for mothers who are unaware that they have the infection. So it's an important intervention, and majority of countries do still give hepatitis B at birth, and it should continue to be given. What is Guillain-Barré syndrome? Is it related to getting vaccination when patient has flu, fever? How to avoid it? So Guillain-Barré syndrome is a neurodegenerative disorder. It's an extremely rare disorder, and individuals are more likely to get Guillain-Barré syndrome from the flu itself, which the vaccine prevents, than any risk which could arise from the vaccine. So the message should be clear that the flu vaccine should be encouraged. How the parents would know if their child has any allergies for the vaccine components. I think Dr. Abdurrahman went through this. If they have developed a previous reaction to a vaccine or any of the vaccine components. So previous exposure is what defines it. Without previous history of anaphylaxis or severe reaction, it would be difficult to say. But the risk of any allergy in an individual with no previous history of anaphylaxis or allergy to a vaccine would be low. So we would continue to administer the vaccine. Can flu vaccine be taken with hepatitis vaccine? I think Dr. Abdurrahman covered that. It can be co-administered with other vaccines. Flu vaccination registration can be done on MOH site or any other link is available. Once the campaign is launched, there will be a link on the MOH website for registration. There are other sites which have taken part this year who will vaccinate the population who they serve, such as Kuwait University, the KOC, hospitals, the military hospitals, the Ministry of Interior. But for the general public, it's be through the MOH website, and the registration will be done online for it. And that is the questions which are available, which have been sent online. If anyone wants to ask any questions from the audience, please feel free. To any of us, Dr. Abdurrahman or Dr. Najih are happy to answer the questions as well. صح. Hey. Thank you for the question. I'll just summarize the question for those who didn't hear. There was a question on when will the campaign start. The second part of the question is how long will it last? The third part of the question is how many doses would be available for the vaccination campaign. So just to start off with, when will the vaccination campaign start? It will start the last week of September, so after the 25th of September. And there will be a letter distributing the amount of vaccines to all of the vaccination sites. This year, we have increased the amount of vaccines available. Last year, we had vaccinated 337,000 individuals, and we aim to increase by 20% on year, given the strategies we had mentioned. So this year, there'll be a total of 400,000 doses distributed across all existing sites and all additional sites, and the majority of which will be distributed to early on in the season. So there will be enough vaccines distributed to every center to not have to, so centers won't turn people away who attend for vaccinations. How long will the vaccination campaign last? It will last throughout the season. So to last throughout the season. So but the main aim is to vaccinate the larger number of people within the next 3 months. So if you are for hospitals or heads of preventive areas which are focusing on when to focus most of the staff, most of the vaccination campaign and most of the individuals will be covered within the first 2 months. So focus on increasing the nursing capacity and during those months to make sure majority of people are vaccinated during that period. And for the rest of the period, you could reduce the number of staff to cover just those who may have delayed their vaccination or not have received their vaccination towards that period. Yeah. So for the first 3 months, it depends on the health region and how they work the number of doses. So each health region is free to schedule the appointments. We recommend continuing the vaccination, mainly intensity, and keeping the majority of vaccination clinics during the first 3 months, with continued service after December and early next year as well. So have service throughout the vaccination season, with most of the vaccination sites, with all of the vaccination sites remaining open during the first 3 months. There is any other question? Yes, there is. The question is how many appointments are sent per clinic, per center. So we haven't sent it will be similar to last year. So there will be approximately 20 appointments per hour per vaccination clinic. Not everybody attends at their scheduled time, so there will be a reduction in the number of individuals who actually attend to the vaccination clinic. Individuals with previous appointments or appointments at different times should be accommodated, and if they attend after their scheduled appointment time. The main thing, I think the main goal is we don't want to turn people away while avoiding crowding. So it's a challenge and it's difficult for the individual centers to manage. But every person we turn away would be a missed opportunity, because we don't know if they will come back for vaccination again. So as long as we minimize individuals we turn away, that would be best. But at the same time, you know your service, and we wouldn't want crowding at the same time. So if you have to reschedule individuals because of crowding, then that would be okay. And the system is there to help you. The system is there to help organize and prevent overcrowding. But from the clinic point of view, the clinics are free to organize their acceptable level of crowding. الملخص summary in the first question is related to adverse events. Is there an adverse event system for severe disease for those who develop severe complications, following vaccination? So currently, individuals who attend hospital for COVID, so there is an adverse event currently in place for COVID vaccination. It doesn't exist for other vaccinations as of yet, but individuals which do attend to hospital, the focal point for the COVID vaccination will monitor adverse events for other vaccinations in the interim until it is formalized. So there is a plan to launch a formal adverse event reporting mechanism for all vaccinations. And this will take approximately 3 to 4 months until it is finalized. It will leverage onto the adverse event reporting mechanism for COVID. So currently for COVID, how it works is there is a link for any individual which feels that they had developed a complication, whether it's related or not to COVID-19 vaccination. They will log on to the online system, report their symptoms, and free text whatever they feel is the issue related to the vaccine. This is then investigated by a community and committee and followed up by a medical team. In addition, this is patient reported. So there is hospital-based reporting as well at the same time. So focal points present in different hospitals are responsible to monitor individuals who have received recent vaccination prior to hospitalization, and this will be investigated by the focal points as well. So this is for the COVID vaccination. The same thing will be leveraged for routine immunizations and adult vaccinations as well at the same time. So this is happening. It's the Drug Regulatory Authority in the Ministry of Health is responsible for this, but it's just conveying the information that this is currently being done. The second part was related to the appointments. I think the questions. Yeah, so unfortunately within IT systems, some errors do happen. So with the appointment system, bulk of the individuals will receive appointments at a specified time, and some centers might close early or open late. So there are some times where an individual would receive a message when, say, said center is closed. Obviously with IT, we'll try to minimize that as much as possible and ensure that everyone would receive an appointment for a time where the center is open. This will be minimized anyway because the opening hours are unified for all the vaccination centers. So it would be difficult to get a message at the wrong time. I think there was another question. Yeah. Yeah. So there's 3 questions. The first question is with regards to the electronic system. Is the electronic system the same as the one used for routine immunization? And the answer to that is yes, it's the same electronic system. On the drop-down menu where you select the routine immunizations and the schedules, there is one option to select winter vaccination. And in that drop-down menu, there's a selection of options of influenza vaccine, the Prevnar and the Pneumovax, so the 13-valent conjugate and the 23-valent polysaccharide vaccines. And you select which vaccines are given to that individual. One additional component specifically for the winter vaccination campaign is there's a risk group function added. So you select the risk groups for that. So you use the same routine immunization schedule, select winter vaccination, open the drop-down menu and select one of the vaccines available on that site. The second part of the question was, yeah, so individuals without civil ID number or who don't have any registration, there's an option called manual vaccination. So you have to have an identification number or a unique identifier which you assign in case they don't have one, a date of birth or something you select, and you register that individual manually using that identifiable, uniquely identifiable number, and you will be able to give the vaccine and open up that site. And the last part of the question? Yeah, so with each health region, they would have access to data related to vaccination for that health region. So this will be report generation. So not everybody will have access to the reports, but there will be a few individuals in each health region who would be able to generate the reports for vaccination. So looking at the vaccination coverage and vaccination data for all health centers, no, each doctor will be able to access it for their center. The heads of the health regions will be able to access it for their region. And this will be compared and audited from at the central level as well. Thank you for your question. Yes. So the question is, do we need to still have a manual record for vaccination? So unfortunately, since this is the first year we are implementing the electronic record, for this year, we would want to compare completeness. So there will be manual recording of the records and electronic recording at the same time, just for this season, since it's the first launch of the electronic system and for the flu campaign. We just want to ensure that once we continue later on, and ultimately we want to make it easier for those who are recording it. This year it would be a bit challenging because there is both recording, but once we demonstrate completeness and we identify that indeed the system has no issues, then from next year we can go ahead with just electronic based recording. Thank you for that question. And I think that's everyone. Yes. Yeah. Yeah, thank you for that question. So the question is, for those who are bedridden and who are not able to access the vaccinations, is there a service for mobile vaccinations? Yes, there is. It will be similar to a service which was delivered last year. The primary care team had a mobile unit for COVID vaccinations where they have a list of individuals who are bedridden or individuals with limited mobility to cover for the COVID vaccinations. They have taken part with the flu vaccine this year, and they will be responsible for giving the doses at that site. At the same time, the preventive medicine clinics, if they feel that there are initiatives to improve coverage using mobile teams, there has been a guidance which was issued by our department, to encourage those preventive health region teams to do out of site vaccination. So if the guidance is followed, they can attend out of facility, but have an out of facility vaccination service. The recording, yes, so they have manual recording system, and the health region where the mobile unit is launched from will record the data. So for all sites, actually, that's an important question. So for example, the Kuwait University vaccination site, they already have a focal point with Farwaniya Health region, where they record this manually, and the data will be entered in the electronic system by the Farwaniya Health region focal point. So every site which doesn't have an electronic health system will be inputted by the relevant health regions focal point for that, and they have already been assigned. Dr. Najih. Thank you very much. We hope that was useful, and we thank you very much for your questions. Thank you.